Hi, my name's Alex. I'm from FilmIt London today. Unfortunately, we don't have Taz weather. I've come to the remoteness of Wales to interview Dr Sarah Myhill, or Sarah, if I can say.
That's absolutely what everybody calls me.
Sarah, would you like to tell us about yourself? You've written
Yes.
3 books, very lovely books here.
I'm a conventionally trained general practitioner. So I qualified in 1981, and that was followed by 20 years in NHS general practice.
20 years, right.
And through that time, it became increasingly evident to me that what people wanted was they wanted to know why they were ill. They didn't want symptom-suppressing medication.
Right.
And so many, particularly chronic illnesses, the doctor's not asking the question, why? Why does this person have this problem? What are the mechanisms by which they're ill? And what can be put in place to address those mechanisms? So often it's, oh, you've got high cholesterol, we'll give you statins. Oh, you've got depression, we'll give you SSRIs. Oh, you've got high blood pressure, we'll give you high blood pressure tablets. And I became increasingly disillusioned with that approach. And I tried to address those issues within general practice by looking at people's diets, looking at their micronutrient status. But increasingly I found I had my hands tied. I couldn't do what I wanted to do. I didn't have the clinical freedoms to be a good doctor.
Is that why you left, sorry?
That's the why I left the NHS. I left the NHS in 2000 in order to develop my ideas outside the NHS. And in fact, there was a funny moment within when I was working locally here as a GP where I had my wrist slapped because my prescribing budget was too low. And because I wasn't prescribing enough drugs, therefore I must have been a bad doctor. Now you would have thought the NHS, finding such a low prescribing budget would have said, fantastic, what's this doctor doing? Not a bit of it.
Yeah, I mean, you don't have to pay, the NHS doesn't have to pay out loads of money, and it means you're doing good, I guess.
Well, I do hope so.
Yeah, exactly.
So since 2000, I started practice outside the NHS. Although I still have several NHS doctors and consultants who refer me patients when they get stuck with them. And the big problem that the NHS really is not grappling with is the problem of chronic fatigue syndrome, or ME. And it's very much being treated as a psychological condition, as evidenced by recent trials and recent services which have been set up.
So it's not all just in the mind, it is a very physical thing.
Absolutely.
What is CFS exactly?
Okay. Chronic fatigue syndrome is the clinical picture, it's not a diagnosis, it's a clinical picture whereby people are chronically tired. Now, if you think about it, an analogy I very much like to use is what I call the Mr. Micawber equation from Charles Dickens. Mr. Micawber, income 20 shillings, outgoing 21 shillings, result misery. Outgoing 19 shillings, result happiness. And it's exactly the same with energy. So when it comes to energy, we have to think of the ways in which the body generates energy. And a very useful analogy is to think of the body as a car. So the fuel that goes in the tank is the diet. And I probably spend more time talking about diet than all other subjects put together. It's such an important player. And part of the diet are also micronutrients, vitamins, minerals, essential fatty acids, and so on. And then we have the engine of the car. And the engine of that car takes fuel from the diet and from the gut. It burns it in the presence of oxygen, so of course blood and heart supply is important, to generate energy. And our engines we call mitochondria, and they are present in every single living cell in the body. Not just our body, every living cell in nature, from frogs to tadpoles to jaguars to whatever. And in fact, this was the subject of the first book I wrote about chronic fatigue syndrome, which I called It's Mitochondria, Not Hypochondria. And that book actually won a highly commended prize at the British Medical Association Book Prize. So I was thrilled with that, as you can imagine. But between myself, Dr Norman Booth, who is a professor at Oxford College, Mansfield College, Oxford, and also Dr John McLaren Howard, who runs Acumen Laboratories, we've now produced 3 papers which clearly show that the worse mitochondrial function you have, the worse your chronic fatigue syndrome, and vice versa. And more importantly, the third paper showed that those patients that put in place the necessary interventions to treat their mitochondria and their diet and all the other aspects I address improved clinically, and that improvement was paralleled by improvements in mitochondrial function. So whilst the mitochondria are not the whole story, it's a really important part of the jigsaw. I mean, you think about it, if you've got a car that wants to go, it's not going to go unless you've got a good engine there.
Sure.
And then there are other facets to make the car go. The thyroid gland is like the accelerator pedal. And if your accelerator pedal doesn't go, then of course the engine's going to run along at 5 miles an hour when you might function much better running at 50 miles an hour.
Sure.
So I deal a lot with thyroid problems, and again, that's one of those conditions which is very poorly treated in this country. The doctors tend to treat the blood tests, whereas actually the blood tests, yes, they're important, but the clinical picture is as important. And there's a wonderful charity called Thyroid UK who do an awful lot of work for patients in that field.
Sure.
And then we have the adrenal gland, which is the gearbox of the car. And again, people who get adrenal fatigue, they can't gear up. And a feature of that is they become intolerant of stress. So they can just about manage, the demands on their plate, but more than that, and they absolutely can't.
What causes CFS? Is there any specific cause? Or?
Well, the causes lie in the mechanisms. And if you can identify why somebody is fatigued, then of course you can address and correct that, then you will address the cause of their fatigue syndrome. But of course, by the time people come along to me, they've often been ill for 10, 15, 20 years, and there's not just one cause, there's multiple causes.
Sure.
So the first thing is to say we look at the car. We look at the engine of the car, the diet, the micronutrient status, the thyroid, the adrenal function, and all that. And then we have to look at how the body is spending energy. And a huge amount of energy just goes on staying alive. Just what we call basal metabolic rate. So that occupies about 2/3 of our energy. So basic heart function, brain function, kidney function, gut function, lung function, and so on. Which leaves about 1/3 that we spend on everyday life. And we spend that energy mentally through mental work, and we spend it physically through physical work. But there are 2 common holes in that energy bucket, as I call it. One is the immunological hole. And the immune system uses up a vast amount of energy. Think of it, our immune system is our standing army. Our standing army is what protects us against the outside world. And standing armies, are greatly demanding of energy. And many patients who come and see me with chronic fatigue syndrome, they have an infectious trigger. The commonest is probably glandular fever, but many other possible infectious triggers. And going back to the very start of how that person developed their fatigue gives you a good clue.
Right.
And if they say, I was completely fit and well, and then I had, terrible glandular fever, typically in the 3rd year at university, at school, and they completely crashed, then I'm thinking viruses. And we now know some lovely work done by Dr Martin Lerner in America that those patients, given antivirals, can often do very well.
So is this a real issue in the world today? Are there a lot of people affected by it?
Huge.
Do you have any statistics that...
It's becoming increasingly common. It is going to become the next epidemic. I mean, one example of this is in children. The commonest reason now for children not being able to attend school is chronic fatigue syndrome, ME.
Right.
More than all other causes put together.
Sure.
And it's becoming an increasing problem in the workplace. And this is why it's so important that the powers that be get to grips with this physical model, because if you address the underlying mechanisms of why people are ill, you can cure them. You can get them back into the workplace.
You don't need to symptom suppress. You
No,
don't need
exactly.
To cover it up.
And the symptom suppressing drugs don't work. In fact, they accelerate the underlying process, because remember, we have symptoms for very good reasons. Symptoms protect us from ourselves. I mean, if you broke your leg and you didn't have pain, you'd go on walking on that leg and the bone would rapidly come through the skin and you'd get gangrene and you would die. So we have symptoms for very clear reasons. It's like if you have a cough or a cold, why do we cough? Why do we sneeze? Why do we have a runny nose? Because all that washes out virus and reduces the virus load. Why do we feel ill? Because we go to bed and we keep warm, and heat kills virus. We rest, so the immune system has got the energy to deal with the virus. And I think a great many cases of chronic fatigue syndrome result when people get a viral infection and then they symptom suppress. They take painkillers, they take antihistamines, they take ephedrine, pseudoephedrine to dry up their secretions, and that makes that infection very much more virulent than it otherwise would have been.
Right. Do you run a private practice here? Do you get many patients with CFS, and how well do you treat them?
Well, I should think at least 2/3 of my workload
and
is
what
by
do you
teaching.
do? Sorry.
Well, I investigate them to try to work out the whys. What are the mechanisms by which they have become ill? So I want to know, how does it start? If it's a gradual onset that's crept up on people over some years, I'm thinking maybe hypothyroidism, underactive thyroid. If it suddenly started with an acute infection, then I'm looking which virus or which bacteria or whatever. Diet, I now know, is a major player, and we have a big problem with modern diets, which is that we are fueling our body with sugars and carbohydrates,
Right.
and that contains a whole heap of health hazards. So I now know that modern diets are a major risk factor for chronic fatigue syndrome, and the reason for that is because we are now fueling our body with sugars and carbohydrates. Now, there's a big debate in the 1970s, should we be eating fat or should we be fueling our body with sugars and carbohydrates? And unfortunately, the carbohydrate world won the argument, and suddenly they became the food of choice. And we have now been subject to 30 years of very poor nutritional advice, which is eat lots of bread, eat lots of pasta, eat lots of biscuits, sugar's fine. And as a result, we're now seeing epidemics of heart disease. Sugar is sticky stuff. It damages arteries directly. It makes blood sticky. We're seeing epidemics of cancer. The difference between a cancer cell and a human cell is cancer cells can only run on sugar. And so high sugar, high carbohydrate diets feed cancer. And we're seeing epidemics of Alzheimer's disease. And Alzheimer's disease is now being called type 3 diabetes. It's diabetes of the brain. And because of that, I produced another book, Diabetes, which summarises all those arguments. And I now have many patients who've been diagnosed with diabetes who have completely reversed their diabetes simply through diet, micronutrients, and all the stuff I do. Because diabetes, again, it's not a diagnosis, it's a clinical picture. It's the clinical picture that arises when blood sugar levels run high. So let's look at the ways of reducing blood sugar levels, and we can do that through diet, micronutrients, correcting thyroid function, reducing toxic stress, and so on and so forth. So in my approach to disease, it doesn't really matter what the clinical picture is. It doesn't matter if people come to me with Alzheimer's disease or diabetes or chronic fatigue syndrome or cancer or whatever. I'm saying, what are the mechanisms that got you there? What did you do wrong in your life that has resulted with this picture?
And obesity epidemics as well.
Indeed.
Do you get any patients who come here? I mean, it's quite a funny question because, you just get told, eat less. But...
eating less doesn't work.
Yes, but wouldn't you say that what kind of diet would you put them on if they came here?
I would put them on a paleo ketogenic diet,
right.
Which is detailed in my book on diabetes. Now, the problem with carbohydrates and sugars is that they're addictive. We eat them in a very addictive way. And if you eat a sugar or carbohydrate, and that might be fruit, so that a typical breakfast would be orange juice, cereals, toast, that's carbohydrate, carbohydrate, carbohydrate. Now, if you took a video of that person's blood sugar, it would be racing up very rapidly. Now, the trouble is the brain likes that. The brain loves a sugar hit because in the short term, it gives a little burst of energy. Mm-hmm. But sugar is very damaging to arteries. It's sticky stuff, it makes blood sticky, and the body cannot permit that blood sugar to raise, to stay high. It's too dangerous. So to control that blood sugar, the body pours out insulin, which is the hormone that regulates blood sugar. So down comes the blood sugar. Now, insulin brings blood sugar down by shunting into fat. So every time your blood sugar spikes, it's being laid down as fat. It's not available as a fuel. As the blood sugar drops rapidly, the brain starts to panic. Ooh, I'm running out of sugar. Brain likes to run on sugar. The brain's a terrible addict. And as the blood sugars come down, the brain throws out the panic hormone, which is adrenaline. Now, adrenaline, it will bring the blood sugar back up again, but it causes all sorts of nasty symptoms. Irritability, panic, tremors, shakes, feeling hungry, fainting, irritable, faint.
I mean, I remember I came to you one time, I don't know if you remember, a long time ago, and I was at school, and every Wednesday morning we'd have waffles, with lots of syrup and extra syrup because, you know, sugar, you can't get enough sugar apparently. And so we, you know, every Wednesday morning, I think it was about 40 minutes to an hour after I'd eaten the waffle, I would pass out or get incredibly dizzy. And you know, and I came to you and I said, well, what's the problem? And you actually said, well, what are you eating on a Wednesday morning? And I said, well, waffles and lots of sugar. And that's exactly, I stopped doing it, and, you know, I stopped almost passing out. There's a lot of truth in it. I can honestly
vouch for that.
Yeah, vouch.
Oh, bless you, it's very nice of you. But the people who are say the carbohydrate addicts, they go through the day with their blood sugars up, and then they fall, and the adrenaline pours out, and they feel terrible, and then they have to eat again, and then, in fact, you can diagnose hypoglycemic tendency or metabolic syndrome, as we now call it, simply by looking at somebody's supermarket basket. And if you look in there, and there's breakfast cereals, and there's bread, and there's crisps, and chocolate, and bottles of wine, all that, the diagnosis is made. They're carb addicts, and they're going through the day, you know, topping up on carbs, you know, on a regular basis, and that is what is so damaging. And the whole problem is compounded at night because they go to bed at night, and they sleep, and then they get low blood sugar at night. Outpouring of adrenaline, it wakes them up. So then suddenly they find their sleep being disturbed. And if you don't get a good night's sleep on a regular basis, it's a disaster. Lack of sleep, again, major risk factor for heart disease, for cancer, for dementia, for chronic fatigue syndrome.
So if I said to you, what would be wrong with eating, you know, a healthy, balanced diet? So you have a bit of, you know, you have your greens, you have your potatoes, you have a bit of meat, and then, you know, you might have a bit of a pudding. What's wrong with the healthy, balanced diet that, you know, contains most of the nutrients you need? Surely that's adequate.
It depends how old you are. Now, young people can get away with blue murder. As Oscar Wilde famously said, youth is wasted on the young. So when you're younger, you have amazing gut, you have amazing digestion, you're very good at producing stomach acid, you're very good at digesting your food, your liver function is fantastic, and you can probably cope pretty well with that. But as you get older, the functions become less efficient. And a problem I increasingly find myself talking about is what I call the fermenting gut. And as we get older, lots of older people say, oh, I can't do big meals these days. Why? Because I feel bloated, I feel gassy, I get reflux. And that's simply because the food they're eating has overwhelmed their ability to digest it. And they start to ferment foods instead. And that compounds all the problems of blood sugar levels going up and down, because if you ferment, what do you produce? You produce alcohol, you produce delactate, you produce hydrogen sulfide. All of those things stop your mitochondria working, so the engine goes slow. It stops the brain working efficiently, so the brain goes slow, and so you become less sharp and everything winds down. So a major interest of mine is what I call the fermenting gut. Now, the human gut is almost unique amongst the mammal world, because the upper gut is a near sterile, acidic, digesting gut to deal with meat and fat. It's like my dog's gut. That's it.
Sure,
like that.
Sure.
Whereas by contrast, the lower bowel is that's the colon, is full of bacteria, and it's a fermenting gut, and it's there to ferment fibre. So my horse, you know, it's a little bit like a horse's or a cow's gut at that point. Now that has brought huge evolutionary benefits, because it means that humans can eat a wider range of foods than any other mammal, bar perhaps a pig. So we have a carnivorous upper gut, which is, say, near sterile, and a vegetarian lower gut, which ferments. Now, what that is particularly suited for is for meat and fat to be digested and absorbed in the upper gut, and vegetable fibre to be fermented in the lower gut. And that's how the human bowel evolved over millions of years, and that's what suits it best. Now, problems came along with the agricultural revolution, because all of a sudden we could grow grains, we could grow potatoes, you know, fruits came in abundance. And in the short term, that has been very successful, because it's meant we can have more people, you know, on this planet than ever before, because we have all these carbohydrates. But whilst it might be very good for reproduction, it's not good for longevity. So that high carbohydrate diet gets us to childbearing and child rearing age. And if you think about it, that's all that evolution cares about. I mean, I'm on the evolutionary scrap heap, I'm not going to have any more children. And so if I die tomorrow, evolution doesn't care. So carbohydrates are very good at getting us, I say, to reproduction. But when it comes to longevity, we can survive much longer if we ditch the carbs and we fuel our body with fat and fibre. So if anybody's going to make the conversion, they need to do it, in their 30s and their 40s, because, as I say, that's going to improve longevity. Having said that, at no stage in life is sugar a good thing. Sugar is damaging throughout life, even children. So much so that we're now seeing cases of adult onset diabetes in teenagers. And we're seeing obesity in our children. It's just escalating. In fact, in the paper today, Dame Sally Davis, who's the government health chief medical officer, is saying we shouldn't be giving children snacks. They shouldn't have access to the freezer, to the fridge, to help themselves to food. The crisp bags are getting bigger than ever. We are feeding our children junk, and we are going to be seeing epidemics of diabetes and premature death as a result. In fact, I confidently predict that we will see a generation where children will be dying before their parents because of their current appalling diet. I mean, it's a terrible thing, but the most common reason for a hospital admission for children is dental decay, because their teeth are going rotten. If you're eating sugar, not only have you got fermenting gut, you've got fermenting mouth.
Causes a whole heap of problems, doesn't it?
Absolutely, yeah. Sugar is an absolute deadly poison. In fact, I rate sugar as pernicious as smoking. I'd almost prefer a child that smoked a cigarette and had a Mars bar. It's almost got to that stage.
So I have a question. I've recently talked about this kind of the sugar in relation to as a fuel to the brain. Apparently, the brain cannot run off fat. It has to run off glucose. Is that a fallacy?
No, that is a fallacy. That is not correct. In fact, there's a lovely study that was published in the BMJ, I think in the 1960s, that looked at people who were running their body on fat. It's called being keto adapted. And they could run a blood sugar of 1 picomole per litre, a normal range we consider to be maybe 3.5 to 6, 3.5 to 7, without getting any symptoms at all. In fact, the brain prefers to run on ketones, which is what happens when you burn fat.
Isn't that incredibly unhealthy though? Doesn't that suggest the patient's starving?
No. It tells us, if you're in ketosis, it tells us that you are fueling your body with fat. I'm in a permanent state of ketosis because I eat a very low sugar, very low carbohydrate diet, and I know my brain is much sharper as a result. In fact, the ketogenic diet is the starting point to treat many brain pathologies. So epilepsy, it's very well established. If you want to cure epilepsy, eat a ketogenic diet, and very often that will do the trick. There was a case reported in New Sartis recently of a young boy who had a malignant glioblastoma, which is a nasty malignant brain tumour. He cured himself with a ketogenic diet. Why? Because cancers can only grow on sugar and carbohydrates. If you eat a very low sugar carbohydrate diet, that helps to starve the cancer out. Now, I wouldn't advocate that as the sole treatment for cancer. If you've got a nasty cancer, you've got to hit it in all ways you possibly can. If surgery is available, you take it. If radiotherapy is available, you take it. If chemotherapy is available, you take it. But it's a very important adjunct to therapy. It greatly improves the success rate of any anti-cancer treatment.
Well, you've seen it, haven't you, with your patients?
Indeed.
Do you have any examples of it? Naming no.
Indeed, yes. And I have had several patients, who have gone down the conventional route for treating cancer, and they have done a ketogenic diet. And I in fact had a lady came to see me recently, and she said to myself, do you know what, I've never felt so well in my life, and what I'm so cross about is that I had to wait until I got cancer before I really sorted my diet out. And having sorted it out, she's lost 3 stone in weight. She goes out walking every day and her brain is as sharp as anything. In fact, in my book Sustainable Medicine, which is one of the early books I produced, in the back of this book there is a case history of a patient called Carwin who had chronic lymphatic leukemia, and we traced her white cell counts over 10 years. Now, she has had no conventional treatment. We've simply treated her through diet and nutritional supplements, and in the first 2 or 3 years her white cell count slowly increased, and then we found out she had been poisoned by lindane, which is a nasty toxic organic chlorine. So she detoxed and got the lindane out of her system, and that was the marker for her white cell count to come down. And it's been coming down progressively for about the last 6 years. And now, if you did a blood test, you'd say, oh, that's a normal white cell count. She doesn't have chronic lymphatic leukemia. But of course, she continues to hold in place the ketogenic diet, the detox regimes, the vitamin B12 injections, all those things which have helped her. And she is incredibly fit and well and active in many spheres.
And stress is a very good thing, as you say. I mean, symptom suppressing, as you say, the cancer patient got onto the ketogenic diet through the fact that she had cancer in the first place. Now, if you suppress them, she wouldn't have had the opportunity to do so. I know she would have knew that she had cancer. She would have known she had cancer. But at the same time, it's your body telling you something, isn't it? Indeed,
and I wouldn't like everybody to have cancer as their wake-up call that makes them change things.
This is why we're doing this. We need people like you.
Well, I mean, I now know I can't treat everybody, but what I can do is I can give people the information they need to do it themselves. And that is now my big aim in life, to produce the books so that people have the knowledge so that they can do it themselves. And I'm also in the throes of setting up a website, which I'm going to call Natural Health Worldwide. And the idea of that website is it's going to be a marketplace for opinions. So any patient can access any therapist in the world. Now, that therapist might be a conventional doctor. They might be somebody with a qualification in herbal medicine or naturopathic medicine or nutritional medicine or whatever. Or it might be an experienced patient, i.e. somebody who's been there, who's had that illness, has seen what all the options are and has survived, recovered, who can advise other people. Exactly. And I think that is the category that most interests me, because those experienced patients know so much. They've explored it themselves, they've been through the internet, they've inquired with people, and they have found a path that has worked for them. And of course that's hugely encouraging for anybody who's been freshly diagnosed, because they can see somebody who's been there, suffered, got their way through it, and are now looking to help others. And I think it's going to be a really important part of the website.
So obviously it's diet is specific to each person in a sense that it depends what their problem is. But if someone came to you with cancer, for example, what would you say? Would you say exercise a lot? Would you say ketosis?
I mean, you say, I mean, yes, there is a certain amount of fine-tuning of diet, but the bottom line is that the human gut evolved over 2.5 million years, running on fat, fibre, and of course protein. So that is the evolutionary correct diet. That is the diet that our bodies need. Now, thanks to modern farming and cooking, we can make that diet very comfortable. So I can now, for example, and in fact I'm writing as we speak a book which I'm going to call the PK Diet, or the PK Cookbook, the Paleo Ketogenic Cookbook. So it's how we can nourish ourselves on fat and fibre and protein, i.e. it's a very low carbohydrate diet. And the early chapters are about how to get into ketosis, because that is awkward, that's difficult, that's hard work, because there's a metabolic inertia in the system. But then it's all about maintaining it. Having got into a ketogenic state, that's then got to be sustainable. And what helps enormously are 1 or 2 recipes. For example, I've just spent the summer putting together a recipe for what I call PK bread. And I can now make a bread which looks, cuts, slices, tastes like a small Hovis loaf. And the only ingredients are linseeds and water. And I have to say that is the most exciting thing I've done this summer. And it has transformed people's lives, because all of a sudden it's only 1% carb, it's very high in fibre.
Does it taste nice?
It tastes delicious. I will make sure you have some. So there's a whole chapter devoted how you can make your bread, and it takes me 5 minutes to make. I've got it down to a fine art now, so I'll be putting a YouTube up about that at some stage. And then the next chapter is what I call PK dairy products. You see, dairy products are responsible for so many diseases. you see, nature intended dairy products for young mammals. If young mammals don't grow very quickly, they get eaten by saber-toothed tigers. All dairy products have growth promoters, and that makes them a risk factor for cancer.
What's a growth promoter exactly?
It's something that makes young mammals grow faster than they otherwise would if they didn't have the dairy products.
What would an example be?
Well, human growth hormone is present in there, and of course cows have natural bovine growth hormones, and many of the American cows in particular are injected with growth hormones in order to make them produce more milk, but of course that then comes through into the dairy. So there are natural growth promoters in dairy products and there are artificial growth promoters in dairy products. So, and part of the reason why we are seeing, taller people than ever before and fatter people than ever before are the amount of dairy products they eat and the high amounts of sugars and carbohydrates in their diet. So dairy products, they're fine for, babies that have been recently born to weaning age, but after that we shouldn't be using them. The trouble is dairy products are absolutely delicious. We love butter, we love cheese, we love cream. But again, in the book I list some very palatable alternatives and based largely on coconut milk. And there's a wonderful product I use called Grace Coconut Milk, which is homogenised, instant, it pours from the carton like single cream, and it has transformed my patients' lives. And in fact, and indeed mine, and that blended with coconut oil, you can make double cream. If you put more coconut oil in, you can make a clotted cream with it. You can ferment it very easily, and it makes a delicious yoghurt. In fact, there's one on the market called Koyo yogurt. No, I don't have shares in the company. And Koyo yogurt is gorgeous to eat. So you can get all those textures from other fats, coconut oil, coconut fat, palm oil, palm fat, and of course other vegetable oils and fats.
Sure.
So suddenly when you've got PK bread and you've got PK dairy products, life becomes very much easier because you've got those delicious foods. And the other good thing about a ketogenic diet is if you took a video of somebody's blood sugars, they'd be absolutely level. You don't get any uppers, you don't get any downers. And if you don't get any uppers, if you're not spiking insulin, you don't put on weight. So you can eat a high calorie diet and keep the same weight. And you're not getting any downers. So, it'll work, it's so much better. In fact, I don't need to eat lunch anymore. And I find if I don't have lunch, I function much better in the afternoon. I'm well into ketosis. I've not got blood sugars going up and down saying, oh, you must have something to eat now. You're just not going to be able to get through the next hour. It doesn't happen anymore.
And you're not addicted to it anymore. You don't
Correct.
have the urge to...
Correct. Now, I tell you where I learned all this stuff from. I learned this from the athletes. Because the endurance athletes find they can perform much better on a ketogenic diet. And there's two reasons for this. The first is that if you are running your body on fat and you can access the fat in your body, then you have a fuel supply that will run for marathon after marathon after marathon without having to refuel. It's a feature of marathon runners who run their body on carbohydrates that they run out of fuel at about 16, 17 miles. Now we call it hitting a wall. The Americans call it bonking. But what those athletes find is that as they're running, they have to have something sweet, a sugar drink or chocolate bar or something like that, in order to keep going.
So carbo loading is a load of rubbish.
Carbo loading is a load of rubbish.
But in
it works in the short term, but it reduces their performance in the longer term. Now, there's another factor here as well, because if you carb load, you store your carbohydrate in the liver as glycogen, and also in the muscle as glycogen. Now, glycogen has an osmotic force. It has to hold water with it. So you can't have glycogen without holding on to extra water. And that extra maybe litre or litre and a half of water is another 3 or 4 pounds of weight that you're carrying. So your power-weight ratio is at a disadvantage because you have a small fuel tank and you're carrying an extra 3 or 4 pounds in weight. Now that makes a difference, in long distance runners. I read recently the book about the racehorse Seabiscuit. And Seabiscuit was a champion racer in the 1930s. You've probably seen the film about him. And in that book I learned that for every extra pound that horse carries, makes the difference of a length over a mile. So if that horse is carrying extra, 7 pounds, say, which could be fluid or as jockey, then over a 3-mile race, that's going to make the difference of 21 lengths. That's huge. That's the difference between, a gold medal performance and an also-ran. So being in ketosis is a very good thing for the endurance athletes. Now, I'm not so sure about the power athletes, that might be a different story. But as I say, I learned all this stuff, or a lot of this stuff, from the athletic world.
And what would be an example of a, ketogenic diet? How much would you eat during a day, for example? What would you eat?
Well, you can eat as much calories as you like. The question is, where do those calories come from? And the important thing is they must come from fat and they must come from fibre. Now, it's not a high protein diet. People think, I've got to eat a lot of meat. No, you don't have to eat a lot of meat, but you have to have a lot of fat. The trouble is, we have been brainwashed as a Western society into believing that fat's bad for us. We are told, and it's deep in the subconscious, fat will cause high cholesterol, which will cause heart disease. Nonsense, nonsense, nonsense. What causes high cholesterol is sugar and carbohydrates. What damages arteries is sugars and carbohydrates. Every time your blood sugar falls, you pour out adrenaline, and that puts up the blood pressure. So the high blood pressure of the adrenaline, combined with the sticky sugar, that's what wrecks our arteries. Now, cholesterol is pulled in to heal and repair those arteries. And therefore, there's a causal relationship between cholesterol and arterial damage, not a causal relationship. So the cholesterol story is a symptom of arterial disease. It's not a cause of it. Now, the next thing people then jump onto me and they say to me, well, what about statins? What about statins? Where do they fit into this? Statins are one of the drugs I absolutely hate, I have to say, and I don't have a single patient in my practice who is taking statins. Statins, they do reduce the risk of heart disease, but it's got nothing to do with cholesterol. It just so happens, through pure serendipity, that statins look like vitamin D. And vitamin D is anti-inflammatory, it's highly protective against heart disease, it's highly protective against dementia, it's highly protective against cancer. So we can get the statin effect just by giving our patients vitamin D. Guess what's safer?
So what's your opinion on fasting exactly? Intermittent in this case.
Well, fasting is a very good thing for the body. And there are several reasons why that is the case. It helps to reverse metabolic syndrome faster than anything else, and let me explain that. Now, particularly for people who are eating starches and carbohydrates, when you eat a starchy meal or a sugar meal, it goes into the bloodstream from the gut. Now, it goes into the portal bloodstream, and what that means is all that blood goes straight to the liver. It doesn't go into the systemic bloodstream, but it goes straight to the liver. Now, the liver has what I call a glycogen sponge. And so that spike of sugar that goes into the liver should be immediately mopped up by that glycogen sponge so it doesn't spill over into the bloodstream. Now, the problem with people who are eating sugars and carbohydrates on a very regular basis is they never empty their glycogen sponge. It's constantly saturated with sugar. And what that means is the sugar spills straight over into the bloodstream and causes metabolic havoc. Now, there are two good ways of emptying your glycogen sponge. One is to exercise, because you burn sugar when you exercise, and the glycogen sponge in your muscles and your livers, squeeze dry, as I call it.
What kind of exercise?
Any exercise that uses energy. Walking, running, cycling, whatever. But another very good way of squeezing your glycogen sponge dry is not to eat, is to fast. And in fact, there's a lovely study that has come out of California by a consultant neurologist called Dale Bredesen. And he took 10 patients with Alzheimer's disease. Now, as I mentioned earlier, Alzheimer's is now being called type 3 diabetes. It's a sugar carb problem. And he put his patients on a ketogenic diet. And part of the rules of the game was that they had to eat all their calories within a 10-hour window of time. So if they had breakfast at 8 o'clock in the morning, they had to have finished their supper by 6. And they weren't allowed any snacks between the two. So they had to have a 14-hour fast within each day. Now, what was so interesting about that study is 9 out of 10 of those patients reversed their Alzheimer's disease and returned to normal brain function. 4 of them got back to holding down jobs. The one lady who couldn't do the study just couldn't stick with the diet. She didn't have sufficient support to help. Now, they all complained like mad about it. They didn't like the diet, they didn't like the fasting, but they did it. And I say they reversed their Alzheimer's disease. Now, if that had been a drug that had done that, that would have made headlines in every single newspaper in the world.
How do you reverse Alzheimer's disease? Because surely it damages the brain tissue, and the brain tissue can't actually be repaired. Or
the brain is very good at healing and repairing.
It can repair. Okay.
It has remarkable abilities to create new connections. In fact, throughout life, the brain will generate 1 million new connections every second. So don't think the brain is a lump of stone that gradually gets eroded. It's a very plastic, mobile, extraordinarily adaptable organ that will adjust to any circumstances thrown at it. And if you give it the right condition, it will function at a very high level. But we are literally poisoning our brains with sugars and carbohydrates.
There's a very good documentary called, I think it's called Eat and Live Long, or Eat and Live Well. It's a Horizon documentary by Michael Mosley.
Oh yeah.
I don't know if you've seen it, but he goes into fasting as a means for just health and longevity.
Yes.
And there's a lot of evidence. So if anyone doubts fasting, as a good dietary alternative, it's very good. I can vouch for myself that I'm A, more alert when I fast, and B, I lose weight, which is quite nice for a certain amount of time. It's also when I get ill, I get better a lot quicker. And there's a reason, I guess, dogs don't eat when they're ill, and it's because they don't have this kind of human reason that's kind of been wronged in a sense.
Well, another advantage of fasting is you empty the gut, and by emptying the gut, you then hugely reduce the number of gut flora that's there. Now that provides an enormous toxic load for the body because there are trillions of microbes in the gut, and they very easily get into the bloodstream. That's called bacterial translocation, and they cause metabolic havoc in the body. So you're reducing that load. You're also reducing the fermenting gut load. Now, another astonishing statistic is that at rest, the brain uses about 20% of all the energy. The heart uses about 7% of all the energy that we burn, but the liver uses 27% of all the energy that the body consumes. That's a massive amount. And the reason the liver uses so much energy is because it's dealing with everything that's coming through the gut, the bacterial load, the sugar rushes, the products of fermentation, and so on. So if you fast, you give the liver a huge rest. And then energy is available for the immune system to fight infection, for the brain to work better, for the athletes to perform, or whatever. But that only works if they're keto adapted and they can get fuel from fat. If they're running on carbohydrates, then you might be switching off their energy supply, which isn't such good news.
And all those students listening, who are, the alcohol. Also, doesn't it lower your insulin factor growth hormone as well, fasting? That's what I heard in the Michael Mosley.
Of course, because if you're not spiking blood sugar, then you're not spiking insulin and the growth factors that go with that.
And there's a big link to that with cancer, isn't there?
Huge. I mean, sugar feeds cancer. It's a growth promoter. It's a fuel for the cancer cells. I say the starting point to treat any cancer is the ketogenic diet. Now, obviously, by the time people come and see me, they've got big cancers, and the ketogenic diet on its own isn't gonna do the job. For many cases, you still need the surgery to get rid of the bulk of the tumour, or the chemotherapy, or the radiotherapy, or whatever. But as I say, the ketogenic diet is a vital adjunct and an incredibly helpful part of preventing recurrences and improving longevity.
Is that the same as the Stone Age diet that I've seen listed on your site?
Okay, the Stone Age diet is essentially a ketogenic diet, but of course, primitive man lived during the seasons, and during the autumn he'd have had a windfall. There'd have been, the apple tree would have ripened, the potatoes would have ripened, there would have been a natural wild harvest. And during that time, he would have feasted on carbohydrates, honeys, apples, fruits, root vegetables, or whatever. And he'd have temporarily switched into metabolic syndrome, and he'd have run high blood sugars, high insulin, and he'd have put on weight. Now, gaining weight in the autumn is very useful. It keeps us warm for the winter, and it's a fuel source because we store those carbohydrates as fat in the body. But the point is with primitive man is that fuel source would come to an end. The harvest, when the cold weather came in, he would no longer have his grains, his potatoes, his fruits, and he'd have switched back into ketosis. So that window of time, essential, and that's what you like is a Stone Age diet. But these days I tend to talk more about paleo diets, i.e. you can have the occasional window of time when you switch into metabolic syndrome, but we shouldn't be living in permanent autumn mode. That's what we're doing at the moment. That's what Western man is doing at the moment. We're in permanent autumn mode. I beg your pardon?
Do you think we haven't adapted to the Western style? A lot of critics of the paleo diet who say that we've actually our bodies have adapted to cope with these diets.
Some people have adapted, and we have adapted to the extent we can get to childbearing age, but it doesn't get us to our full potential. I mean, we have the potential to live to 120. There's one French lady, Jean Calment, who has achieved that, and but most of the centenarians, if you look at their diet, well, people in Japan, for example, who do eat a very traditional, paleo diet. So we are, our longevity has improved. So, lifespans in this country probably at 70 or 80. But what you have to remember is those people, when they were young, they weren't eating the high carbohydrate diets that young people are eating now. And I predict that we will see a window of time when our longevity will fall. Why? Because the young people are now eating such awful diets. Junk foods, high in sugar, high in carbohydrates, obesity. We're seeing all those conditions in young people that we never used to see. I mean, when I was at school, I don't ever remember a child having a fracture. But now, to a penny, kids falling over and they're breaking their wrists and they're breaking their collarbones and they're breaking their ribs. That was a very unusual event. And it's because the micronutrient status of food is not as good as it should be. The kids are being fed high carbohydrate, high junk food diets, and they are simply not as tough as they should be.
So this brings us on to nutritional supplements. I'm actually a big fan of vitamins and minerals, as all of my friends would notice. But why would you advocate someone taking them, and what do they do for you?
Okay. Well, we have a fundamental problem with modern Western diets, which is that there is a one-way movement of minerals from the soil into plants, into animals, into us, and we throw them away. We're not recycling onto the land anymore. Now, you look at any Ministry of Agricultural figures, or DEFRA figures as we now have to call them, any government figures, and you will see that the micronutrient content of food has declined progressively since modern farming came in. So the calcium levels is lower, the magnesium level is lower in food, the iron levels is lower, boron, zinc, copper, selenium, the lot. So you could be eating the most perfect, organic, biodynamic diet, but it doesn't have the minerals there that it used to have. Now, if the plants don't have the minerals in them, they can't make the vitamins. So the plant material that we're eating is becoming, the vitamin content is declining. All the B vitamins, A, D, E, C, they're all on the slide. So my view is that you do the best you possibly can with your diet. You eat a good PK diet. If you can get organic, fantastic. But we still need to take supplements over and above that in order to compensate for that loss that has been generated by modern Western agriculture.
So when a supplement says on the back, it says the RDA, and it's some of the supplements on mine, for example, are I think it's 1,500 for selenium, for example. Isn't that too much?
Okay, well, you have to ask yourself, what is the RDA based on? And the RDA is based on the amount that you need to prevent disease. So the RDA for vitamin C would be 30 milligrams. Now that'll stop you getting scurvy, but it won't keep you in optimum health. Now, there's an interesting story about vitamin C, because it's humans, fruit bats and guinea pigs are the only mammals that can't make their own vitamin C. We have to eat it, we have to consume it. The reason my dog doesn't get scurvy is because she can make vitamin C from her normal meat diet. Now, if you adjust, if you look at what the amount of vitamin C that a dog will make, or a horse will make, or a goat will make, and you transfer that to humans, we should be consuming at least 2 or 3 grams of vitamin C a day. That's 2,000 or 3,000 milligrams. The RDA is 30 milligrams. There's no comparison.
Right.
So 30 milligrams, you won't get scurvy. But to function at your best, you need 2,000 or 3,000 milligrams of vitamin C.
And these guidelines were set a long time ago, weren't they?
Yes, and they haven't moved recently. So they really are the very basic guidelines. Now, the joy of vitamins and minerals is they are all extremely safe. It would be very difficult to poison yourself with a vitamin or a mineral. And therefore it's very safe to consume 10 or 20 times the recommended daily amount. You're not going to run into any problems.
So don't you pee all of this stuff out, or not?
Well, you pee antibiotics out, but that doesn't mean they don't do a lot of good on the way.
Yeah.
Everything we excrete, but it doesn't mean they don't do a lot of good on the way.
Sure.
So, my view is we should all be taking a good multivitamin, a good multimineral, some good essential fatty acids, some vitamin C and some vitamin D, just as a basic package. In fact, when I'm treating a patient, it doesn't matter really what their clinical picture is. They all get what I call a basic package of treatment, which is a PK diet, micronutrient supplements, advice about sleep and are they getting enough of it, advice about exercise and now they're getting enough of it, and that basic package I detail in Sustainable Medicine. So if you just want to know what you should do to live your life to an optimum, to maximise your longevity, this would be the starting point, the basic package that's detailed in there. And then I have what I call the bolt-on extras, because people don't come to me well. They come to me with an illness. They come to me with asthma, or they come to me with eczema, or with chronic fatigue syndrome, or arthritis, or whatever. And then, as I say, I have nutritional interventions which are of proven benefit, whether we're talking about arthritis, or whether we're talking about allergies, and techniques to desensitize, or whether we're talking about gut problems like inflammatory bowel disease or irritable bowel syndrome. There are, I say, what I call the bolt-on extras. And again, the bolt-on extras are detailed in Sustainable Medicine.
What exactly do vitamins do on a biological level?
Okay. The way to...
Briefly.
Well, the way I think... If you think of the body as a language, and languages are made up of books, of magazines, and they are made up of paragraphs, and they're made up of sentences, and sentences are made up of individual letters. Now, vitamins and minerals are the letters of our body. We can't make them. We can't synthesize in the body. We have to have those letters in order to create a language. Without those letters, we cannot be a whole and complete and rounded human being. And because our diet is deficient in those letters, my view is chuck them in. Can't do any harm with them. We can only do good. It's a very good insurance policy against disease.
There are a lot of articles actually in the newspapers to say that selenium, for example, or minerals cause cancer. What would you reply?
You have to, whenever you look at any study like that, you always have to follow the money. Now, there is a wonderful character whose name won't come into my head, but he is a doctor who specialises in looking at studies. And he is one of the big players in the Cochrane Centre. Now, Cochrane reviews are the gold standard of medical publishing, if you like. And there's a recent Cochrane review that was done looking at drug trials. And what you have to remember is nearly all these studies are bankrolled by pharmaceutical companies. Now, you can set up a drug trial or an investigation in almost any way you like in order to get a desired outcome. And what we find by looking at those trials in detail is so many of them have been set up and skewed in order to get a desirable answer. Now, the sort of trials you're looking at, they will look at micronutrients in isolation. A high level of this doesn't protect, a high level of that doesn't protect or causes problems. But, have you ever tried writing a book where you're only allowed one letter? It's not going to happen. It's just impossible. So, X you might only need that very occasionally, but without X, there's no sex in the book, and who's going to read that? There's no exercise either. So, the point is, these micronutrients are all interdependent to get a result. You can't just use one and expect to get a result. It's like you can't make a meal with just one or two ingredients. You've got to have the whole lot. And that's the study that wants to be done. It wants to be a study that looks at the whole package. And in fact, that study has been done already. It's called life. It's called experience. We know that people who are eating primitive diets don't get nasty tumours. If you go to Africa, and look at people eating traditional African diets, they don't get the cancers that we don't get. They don't get the breast cancers and the bowel cancers and the brain tumours. They get different tumours for different reasons, but just a study of the epidemiology tells us that what we're saying here is correct.
So we have a big problem with depression and anxiety in this country. How would you what's the cause, do you think?
Okay. Again, these are just symptoms, they are not diagnoses. And anxiety is different from depression. Let's start with anxiety. Now, anxiety is an adrenaline symptom. What's the major cause of adrenaline release? Falling blood sugars. So the starting point to treat anxiety is a PK diet, a Paleolithic ketogenic diet. Let's iron out the blood sugar levels. And we're currently seeing epidemics of anxiety at the moment, and we're seeing epidemics of eating disorders like anorexia and bulimia. Why? Because of modern high carbohydrate diets. So the starting point to treat anxiety is a PK diet. And for many people, that's all you have to do to achieve that. Now, there are other micronutrients that are very helpful. Magnesium, for example, has been dubbed nature's tranquilizer. Essentially, calcium excites, magnesium relaxes. Guess what? We're all magnesium deficient. Why? Two reasons. The diet we're eating is magnesium deficient because we're not putting magnesium onto the soil, we're throwing it all away. And secondly, we're all deficient in vitamin D. And vitamin D is essential for the absorption of calcium and magnesium. So just addressing those simple things will cure a great many anxiety problems. Okay, then we switch on to depression. What is depression all about? Now, as I mentioned earlier, at rest, the brain consumes 20% of all the energy consumed in the body. It only weighs 2%, but it consumes 20% of the energy. It's massively demanding of energy. Now, if energy delivery mechanisms are impaired, so we haven't got the energy, then the brain has got to stop us spending that energy. So how does it do that? First of all, it makes us physically fatigued, and this is the basic chronic fatigue, so we feel physically tired and we don't want to do things. And then it makes us depressed, because what does depression do? It stops you doing things. What do people do when they're depressed? They don't want to talk with other people. Why? Because that demands a lot of energy. They don't want to get out of bed. Why? Because that demands a lot of energy. They don't want to start new projects. They procrastinate. Why? Because that means the brain's spending energy. So depression is a symptom that stops the brain from spending energy.
Is it not? You talked about depression and anxiety as a purely physical kind of manifestation. Is it not more of a mental thing? So do you not have a way of thinking that is causing your depression rather than just a physical?
Well, there is going to be elements of that, and what we haven't discussed in the energy equation, we've talked a lot about the energy delivery mechanisms, but we then have to look about how we spend energy in the body. And I say there's the infectious hole, or rather the immunological hole, which can be infection or allergy, but there's also what I call the emotional hole. And a proportion of patients who see with fatigue syndrome have suffered abuse in their childhood. Either mental abuse, physical abuse, sexual abuse, bullying, or whatever. And that makes those young people constitutionally hardwired for anxiety. And they're constantly fretting, worrying about the future, what lies around the corner. And that means the brain's using up a lot of energy just, being anxious. And that's almost, well, that is energy wasted, really. It doesn't achieve anything. But, as I say, the brain's been hardwired for that. So, yes, there is always a role for psychological techniques to help people deal with those aspects. But that is not the whole story. It's a relatively small part of the story. An equally important part is to improve energy delivery mechanisms.
Sure. And another topic that I'd quite like to talk to you about is veganism and vegetarianism.
Yes.
What is your view on this?
Okay. Well, there's one can be perfectly healthy on vegan and vegetarian diets. But again, it's the old story. The trouble with vegan and vegetarian diets is they tend to be high carbohydrate, or they're often high carbohydrate diets. And that brings all the problems of high carbohydrate diets with wobbly blood sugars, diabetes, cancer, heart disease, dementia, and so on. But a vegan is probably more healthy than vegetarian, because the vegetarians have a lot of dairy products. And as you know, dairy products carry health problems because they're growth promoting, because they're major allergens. Perhaps one of the commonest symptoms associated with dairy products are catarrhal conditions. Snotty noses, polyps, chronic sinusitis, asthma. Cut out the dairy products, you can cure 70% of them overnight. But the key to vegan and vegetarianism is to get the fuel from fat and fibre. No problem with fibre, because they're eating lots of good vegetables, hopefully, but they mustn't be frightened of including lots of fat in their diet. And there are, of course, vegetarian fats like coconut oil, palm oil, vegetable oils, nut oils, seed oils. So long as they have sufficient of those in their diet to fuel their body, then they can be perfectly healthy.
Sure.
It's not as easy. I'm a carnivore and I love meat, and I love meat fat, and I really good quality meat fat. I don't think you can find anything more delicious. So I come from a particularly jaundiced point of view.
Sure. Is there a difference between organic and non-organic in terms of health benefits, do you think?
The most important benefit is the chemical load. Because of course organic food should be grown without chemicals, whereas inorganic food is grown with chemicals. Now, a test I very often do is a fat biopsy. It's a very easy test to do, but I'm looking for toxins in the body. And I have yet to see a fat biopsy that is free from pesticides. We are all contaminated with chemicals, whether we like it or not, even people who are doing their best to eat organic. So, and of course, all pesticides are known carcinogens, they're known mutagens, they're known immunotoxins. So they switch on autoimmunity and they damage the brain. They're neurotoxic. So we have to do our best to keep our pesticide load as low as possible by eating as well as we possibly can. And there are techniques for getting rid of those chemicals from the fat. So I have now collected about nearly 40 patients now who have had some test of toxicity before and after heating regimes, which might be sauning, it might be far infrared sauning, it might be Turkish baths, it might be intense exercise. And the point is when you get hot, you literally boil off these toxins from the subcutaneous fat onto the lipid layer on the surface of the skin, and they can then be showered off from there.
So there is such a thing as sweating out a hangover then?
Well, it doesn't come out in the sweat. That's a bit of a misnomer. Sweating is symptomatic of the fact getting hot, but sweat, it's probably not coming out in the sweat so much, although I suppose alcohol could come out in the sweat to a certain extent. But I'm more interested in the fat-soluble compounds, the pesticides, the volatile organic compounds, that literally say they boil off onto the lipid layer on the surface of the skin. And as important is the washing off after. If you don't wash them off, then they'll be reabsorbed. But roughly speaking, from the figures I've got, 50 sweating regimes, which is it might be intensive exercise. If you've got chronic fatigue syndrome, that's not an option. Chronic fatigue syndrome, then the far infrared sauning works well. Sunbathing would work as well.
Sure. So
So a sun, sand, sea holiday would be a really good way of detoxing.
along with the vitamin D.
So long as you don't have a glass of, of good cider with it. But roughly speaking, 50 regimes, I reckon, halves the load. Now, you never get rid of every last molecule. The chemicals come out exponentially. So you get rid of half of them in 50, get rid of a quarter of them, in another 50, an eighth in another 50. So you get close to the baseline, but you never really get rid, because, as I say, we live in such a toxic world.
What is your view on homeopathy?
Okay, we know homeopathy works. There are very good placebo-controlled double-blind trials in humans and in animals, interestingly, that shows it's effective. Now, the problem is that the conventional scientists don't have an explanation for that. But I think that what homeopathy is doing is it's retraining the immune system. It's teaching the immune system to respond appropriately. Now, an example of the immune system not responding appropriately would be allergy. I have a great many patients who are allergic to dairy products, who are allergic to wheat, allergic to house dust mite, allergic to dogs. allergic to pollen or whatever, and that's obviously an immune mistake because those things don't cause us any harm. In fact, some of those foods, have potential to do us good. So that's an error of the immune system. Another example would be autoimmunity. We're seeing epidemics of autoimmunity at the moment. It's estimated that 1 in 20 of the population has an autoimmune disease. And in autoimmunity, the immune system makes antibody against itself. Now, that's obviously a terrible mistake. If in a young person it makes antibodies against the pancreas, you end up with type 1 diabetes in children. Type 1 diabetes in children is running epidemic proportions at the moment. Do you know what the 3 risk factors for that are? Dairy products, vaccination, and vitamin D deficiency, lack of sunshine. What are we doing to our kids? We're saying, we've got to vaccinate them all to the hilt, or give them lots of dairy products, they're really good foods, or don't go in the sunshine, it's dangerous, you might get cancer. No wonder we're seeing epidemics of type 1 diabetes. Hypothyroidism, very common. Autoimmune arthritic conditions like rheumatoid arthritis, increasingly common. Why? Because our immune systems are being messed about by Western diets and lifestyle, if you like. Now, I think what homeopathy does is it helps to reprogram the immune system to respond appropriately. And indeed, there are at least 3 desensitization techniques which we know about, which are of proven benefit and in regular use to help reprogram the immune system. And they all involve tiny doses of foods. One is oral immunotherapy, so you can switch off peanut allergy in children.
Small nuts, small amounts.
Yeah, by giving tiny doses of peanut under the tongue, and you gradually build the dose up, build it up until these anaphylactic, kids have to eat a peanut a day in order to maintain immune tolerance. That's one.
It's amazing.
It's fascinating. It makes perfect sense. Another technique that I use is called enzyme potentiated desensitization. Similar thing, tiny dose of food introduced into the skin with an enzyme to reprogram the immune system. And the third is neutralization, which I don't use, but again, it involves injecting tiny amounts of food to re-educate the immune system. And my guess is homeopathy is doing something along those lines.
Sure. Lastly, this is quite a funny question actually, but for all my kind of hungover student drinking friends out there, what would you say could help someone with a bad hangover?
Rehydrate. They're very dehydrated. So drink lots of water, but with that water have salts, and with those salts have fat, because dehydration occurs within cells. And to rehydrate those cells properly, you've got to have the salts within the cells, you've got to have the fats to create the right cell membranes in order that they can create a good semi-permeable membrane, and you've got to have water. So before you go to bed, have a good fatty meal, have lots of water to drink, and some salts, ideally with some minerals in as well, and that will be highly protective against the hangover.
But not carbohydrates.
No, not carbohydrates. That will tend to, my guess is that will make things worse. Now, the carbohydrates will help the low blood sugar that alcohol induces, because alcohol stimulates insulin release and that drops the blood sugar. So it'll help that to a certain extent, but by the next morning, it's probably a bit too late for that mechanism. By the next morning, you need rehydrating.
Minerals and vitamins, I assume.
Fat, vitamins and minerals are the 3 things to take, and that will be highly protective.
Yeah, great. Well, thank you very much for enabling
My
me to
pleasure.
And I hope to see you in the near future to do this again.
Please come with Alex anytime you like.
Great. And these are your books.
Yes, those are the books that summarise what I know. What I would like to do is I want to put together a series of books. There's sustainable medicine. That's the kind of the Bible, if you like, where the basic way I treat the whole of illness is encapsulated. Chronic fatigue syndrome is particularly for those people who suffer from fatigue, and it talks about energy delivery mechanisms. And diabetes goes into much more detail about the diet and why it's so important to cut out the carbohydrates and concentrate on fat and fibre as a fuel source. And my next book is going to be the cookbook. So this gives us the why, the cookbook will give us the how.
So for anything we haven't mentioned here, please either go to your website or your new website that I will link into the YouTube video below, and or buy the books on Amazon.
That'd be fantastic. Thank
Great.
you very much.
Thank you very much.
It wasn't meant to be a plug for my books, but it's all there.
I know.